we'll just go over to our initial consultation with John Roberts. And we've already created some documents here. So we've got, take a look, we've got the comprehensive visit summary. So pop that one open. So we've got the patient's names, the date of birth. We didn't get any ID discussed in the meeting for that patient. Visit details. We don't know the date. It wasn't mentioned in the transcript, so you can go and add that date in yourself. And the location is unknown. So this is, if you don't discuss it in the meeting, the template's not going to get populated. So we mentioned the present complaint. So this is how we've structured the template again to be, this is what we want to see in it. So the patient reports ongoing lower back pain and started with a mild ache about 2 years ago and has gradually worsened, etc. History of the presenting condition, medical history and surgery history, medication and allergies. So it's mentioned the medication that the customer's on there, or the patient is on, should I say. Social history, family history, clinical examination findings. So we've got the spine examination, the neurological examination, general examination. So these are all the stuff that was discussed in this fictional meeting again. So to close that, we've got the treatment plan document. We've got the referral letter to the orthopedic specialist. So you can structure these letters. So if you do send out regular referral letters, this can be your referral letter template. So for Dr. Emily Carter, I'm going to go and create a new template. There's another example. So we're going to go ahead and create a physical therapy referral and home exercise guide. So if I just copy that so I can make that the title easily. I'm going to stick this up here. Again, probably better categories could be created for the medical industry here. Let's just call it a note for now. Okay, so let's take a look at what it's come up with. So physical therapy referral and home exercise guide. So referral details, clinical summary and reason for referral, specific therapy goals, recommended physical therapy regimen. So these are the things that have been recommended. Home exercise guide, exercise instructions, precautions and warnings, monitoring and follow-up, additional notes. So I'll go ahead and accept that and save that again. In case we've got one already, which we might have, let's call it new. Okay, so let's just go ahead and create that new document. I called it exercise new. And in here you can go ahead and, something I haven't mentioned already, is that you can go and add additional instructions. So if you want to add some additional information here that you don't normally include within the template, so for example earlier the TLDR information, if you want to go and add that for this document, you can go and add it there, or anything that's just outside the bounds of the normal template that you create, you can go and add some additional instructions which will just help our AI create the appropriate document for you. So that's, name's just a little bit too long now, so we should give it the physical therapy referral and home exercise guide. Again, we can start reading through this whilst it's getting created right here. Okay, so if we take a closer look at this document, we see the patient info, referring info, client info, and you can see it's got the exercises in here as well. Pelvic tilts, cat stretches. So this was stuff that was mentioned within the meeting. But what wasn't mentioned was how you do them. So the AI has actually gone away, found out about how to do these exercises and added some information in here. So if I show you the transcript itself, if I search for tilt, because I saw pelvic tilt in there, so let's flick through those. You can see it says your home exercise program will consist of 3 daily 15-minute routines, pelvic tilts, cat-camel stretches, but there's no mention of like how you do those. So our AI is away and figured that out and added that in there as like useful additional information.